Today we're going to learn about why you usually get hangovers after taking that alcohol, and we're going to look at how you can be able to treat that and also how you can be able to prevent that so that next time you don't get those hangovers. Now, first of all, alcohol is a diuretic. So one of the things it usually does to your body is dehydration. There's a hormone that we call antidiuretic hormone that usually control how your kidney functions, how your kidney gets rid of water and also retain water in the body. So it controls how this water is being lost. Now, after taking alcohol, this hormone is inhibited, meaning that the kidney will just be losing water without maintaining that in the body, meaning that at the end of the day, you're going to lose a lot of water, and that's why you usually go to the washroom every now and then after taking some few bottles of beer or whatever alcohol that you prefer. Now, so long as we have alcohol content in there, you're going to go to the washroom every now and then. And this is what usually causes dehydration. So dehydration is one of the reasons you usually get those symptoms after taking that alcohol. The second reason is the loss of electrolytes. We have vitamins and also minerals. They're very essential. First, electrolytes are usually lost because, like we said, you're going to lose a lot of water because now you're going to the washroom every now and then because you are already having your ADH being inhibited, or what we call vasopressin. Now, when you have that, you're going to lose a lot of your electrolytes through the urine. And like we said in a previous video, when you don't have a balance in your electrolytes, you have a lot of things that can go wrong. Anything that's touching the nerves, the nerve impulse is usually conducted through the electrolytes. We have potassium and we have sodium. They alternate to relay that signal to the brain. So that's why you usually get so many symptoms like the headache and all those because of the electrolytes. Now, when it comes to vitamins and the minerals, we have vitamin B, we have vitamin C, we have potassium, we have magnesium and zinc, and they are used during the metabolism of this alcohol because your body wants to get rid of this. Now, the minerals that I've mentioned will get used during this process. So when you have a shortage of these minerals, you're going to have aches, like for example, the muscle ache, you're going to have headaches, and also you're going to have fatigue. Now, general body weakness, you feel that you're so tired. The third reason, whose cause is not commonly known, is the aggressive removal of the sugars from your blood. Now, this usually have very devastating effects, and the cause, like I said, is not commonly known. The reason is it's not clear. When you have less sugar in your system, you don't have enough for you to sustain the systems and the cells in your body, and that's why you're going to get those symptoms. Number 5, alcohol might lead to sleep deprivation. Now, okay, alcohol is a sedative, which means that it will make you go to sleep. But then we have hangovers that will come later and they're going to disrupt your sleep. When you don't have enough sleep, you're going to have those symptoms like you feel tired, you feel like you have headaches and all those. So these are the symptoms. Now, when you combine all those things, you're going to have some very terrible hangover, especially depending on the amount of the alcohol that you took and how you took that. Now, let's go to some of the things that you can do to treat this. Now, remember, you cannot treat hangovers within some few seconds. So you can just decide to just sit down and wait for the symptoms to just wear off. But you have some things you can do to speed up this process. In case you don't have any of the things that you're going to mention, then you can just sit down and wait for that to happen. Although it may take longer, treating hangovers may take even up to 24 hours, sometimes even longer. Yeah, so let's see some of the things that you can do to speed up this process. Now, the first one is rehydration. Like we said, alcohol causes dehydration. And to remove the symptoms that usually come due to this dehydration, you rehydrate. Take water. And especially when you're drinking that alcohol, always make sure that you're alternating water, or maybe you can just dilute that alcohol as much as possible and alternate taking alcohol and water. Just mix them so that you get to also replenish the water that you're going to lose to the washroom. Okay, you're going to go to the washroom frequently, especially if you're taking a lot of water, but this is way, way, way better than having your body dehydrated. You'd rather make those trips to the washroom than having the symptoms that usually come due to being dehydrated. Number 2, remember we said that alcohol can trigger inflammation response in the body by increasing interleukin 10, 12, and also interferon gamma. Now, you can treat this by taking NSAIDs. These are non-steroidal anti-inflammatory drugs. Now, we have ibuprofen, we have aspirin, and several others, and you'll have to be very scanty when it comes to using the drugs. If you can avoid them, the better. Now, we have aspirin, which overworks your liver, and especially if you're also taking alcohol at the same time. If you mix the two, they're very dangerous. Also, you can also hurt your stomach. And again, like I said, try to avoid this as much as possible. But if you don't have another option, then just say, so long as you're not taking this regularly, just if it's once in a blue moon. For number 3, I don't recommend this. We call this removing the lock, or maybe the hair of the dog. Now, this says taking alcohol to treat the withdrawal syndromes. Now, people usually take that to treat the hangovers. Now, this is just postponing the hangovers, because what will happen here is if you have those symptoms, it's because you have alcohol withdrawal symptoms. Now, if you add more alcohol, you're going to overexcite your brains, and they're going to forget about the symptoms, and your liver goes back to now trying to get rid of the same. So the actual hangover syndromes will just diminish. They're going to just go temporarily until now the action of the alcohol goes down in your system, in your blood, and then the symptoms for the withdrawal, or what you're calling the hangovers, will come back later. Maybe they even are going to be worse. So taking alcohol to treat this withdrawal syndrome is not the best thing to do. And actually, this thing usually causes what we call addiction, because now you want to take alcohol to treat the alcohol symptoms that you are having. You end up having this cycle every now and then, and this will create that habit. Number 4 is taking complex carbohydrates. Now, you'll have to increase the amount of sugar you have in your blood, unless maybe you are diabetic, of which you still need to take something. Now, take complex carbohydrates so that now the release of the sugar will be gradual and over a prolonged period of time, so your body will have enough of that to sustain all the activities that you have in the body. Remember, we said that alcohol usually remove a lot of sugar from your system, from your blood, leaving little to none for your system to work on for generation of that energy that you require. So you reverse this by adding more sugar to your system, so that your body will get something to work on, so that you just get to generate energy from that. So take simple carbohydrates and also complex carbohydrates to treat the symptom. Coffee sometimes works. It works in other people and not in others. So I'm a little bit skeptical about this one, but it works in other people because it kind of will stimulate your brains and try to caution or to mask the symptoms that you're going to get from the effect of this alcohol. So it can work, it might not work. So maybe you can try it out and see whether it works on you. But there's no direct correlation between the two. So I'm very skeptical about that. Now the final one is time. You'll have to give yourself time for every of that to take place. Usually go on slowly, so it doesn't just work like magic. So you'll have to give yourself time. But if you use the steps that we've said above, it will just try to reduce the time that you're going to recover from this. But eventually, you'll have to be very patient for this to work. Now, how can you prevent this, the hangovers? Now, you're in a situation where you must take alcohol, and you want to minimize how often or the severity of the hangovers that you're going to get later. We have so many of them, but I'm going to mention only 4, but they're very effective. The first one is, like we said, you need to take a lot of water. When you are drinking or you're taking that alcohol, always make sure that you have water with you there. You take alcohol and water, or maybe you over-dilute that alcohol and take your time. So make sure that you're taking a lot of water at that particular time. Number 2, just take less alcohol. There's no known nutritional benefits when it comes to alcohol. This is just for recreational purposes. So just take less of this, because if you take more of that, you're going to have severe withdrawal syndromes later. And if you take less, then it means directly you're going to have less of that. So just take less of alcohol. Number 3, and very important, don't take alcohol on an empty stomach. Now, there's nothing that will go on, nothing much, but when you have food in your stomach, it's going to slow down the absorption of that alcohol through the walls into your blood. So when you have an empty stomach, there will be a maximum absorption of that. That's why when you have taken food, usually take a little bit longer for you to get drunk than when you are on an empty stomach, and it's very aggressive when you have not taken anything. So always make sure that you have something in your stomach, or you can just continue eating and taking your beer. That's why food is very common when it comes to those places that we usually go to drink, and always make sure that you're utilizing that. Pace your drinks. Don't binge drink. When you do that, you're not going to give your body enough time to metabolize the alcohol that you already have. So just take it with a pace. If, for example, you usually take like 5 bottles within 1 hour, that's very fast. You should minimize that to maybe 1 or even 2 in that 1 hour. So just pace them out. Don't take them all in one sitting within a short period of time, because you're going to have very bad withdrawal syndromes. In conclusion, alcohol does more harm than good. There's no known nutritional benefits that you're going to get from that alcohol, apart from now the recreation part of it. And this also tends to push you towards the addiction that will just drive you to the rabbit hole that will be very hard to come out of. So if you can be able to avoid alcohol at any given cost, then do that. It will be very good for your health. If you're gaining value from this channel, give us a thumbs up, and also subscribe and make sure you ring the bell, because we have so much loading. So make sure that every time we upload something new, you get to be notified fast. See you in the next video.